Hi, I'm Judy Griffin with Aroma Health Texas. Today we're going to work with cinnamon for cancer care, and we're going to do a blend at the end of the session, so bear with us. Cinnamon is interesting. You can use the essential oil topically, or you can use an aqueous solution of the cinnamon bark for cancer care. And a lot of the research and work with cancer patients has been with the aqueous solution. You know, cinnamic aldehydes in cinnamon bark is 75% of what you get from the bark. And this is what helps to block pathways to grow cancer cells. It reduces liver toxicity. It reduces or stops stimulation and survival of the cells without injuring healthy tissues. This is important. It blocks vascular growth for blood supply. Cancer cannot make it without creating its own blood supply. And it also blocks RNA expression, so you won't see it being able to metastasize. And the cancer cells cannot talk to each other very easily. So it downregulates formation of blood vessels to survive, and it reduces metastasis. It's been used successfully with ovarian, gastric, breast, melanoma, colorectal, and prostate cancer. And in a minute I'll show you how this is unusual, but it works really well with a antibiotic chemo drug and blocks even more types of cancers. It reduces the inflammatory cascade signals in chronic leukemia that is lymphocytic. It's called CLL leukemia. And it reduces myeloid and acute promyelocytic leukemias. That's a hard one for me. It works on both acute and chronic leukemias. The polyphenols in cinnamon bark reduce the spread of lymphoma cancer cells, both Hodgkin's and non-Hodgkin's. It doesn't work on gastric lymphomas so far. It can be used with Doxorubicin, which is a drug, chemo drug. It's an antibiotic. That's basically what chemotherapy is. And it's used with this drug to increase the death of cancer cells and to help balance and normalize white blood cells, although a side effect can be the white blood cell count reduces, which is very common for a chemo side effect. This combination specifically helps lymphocytes, monocytes, and eosinophils. Doxorubicin is either used in injection or in intravenous, and it helps to stop breast cancer, bladder cancer, kidney cancer, thyroid cancer, stomach cancer, and ovary cancer, plus Kaposi sarcomas, lymphomas, and leukemia cancer cells. That's probably where cancer care with essential oils are going, to find the right match with a chemo drug to drop some of the side effects and make it just super more effective. Now, if you're buying cinnamon bark, the Madagascar cinnamon bark is less adulterated. It's going to have more cinnamic aldehydes, and it's going to be more potent in killing cancers. The Ceylon cinnamon bark is more popular, but it is most often, if not all the time, diluted with cinnamon leaves. So when you make a blend, we're going to take our basic formula and use some of the essential oils that we've talked about before. So we're going to use, for a low note, a base. We're going to use 6 drops of frankincense, which is excellent in many, many types of cancer. And I'm only going to suggest 5 drops of cinnamon bark, because it's very strong in a blend, and use 10 drops of chamomile, because we've talked about how that helps breast cancers and many different types of cancers. Now, if you want, you can just use 15 drops of cinnamon bark, okay? And you'd start with your frankincense. Always use your low note first. Add your cinnamon bark. If you want, use another essential oil with it. And you top it with a high note of 9 drops of lemongrass. Lemongrass, just the citral in lemongrass is a real cancer killer. So we're going to put that in an ounce of carrier oil of your choice. And we keep it out of heat, we keep it out of light, let it blend at least overnight, and use it topically. Sometimes when people are doing chemo, they're detoxing through their skin, so you don't want to slather it all over the person. You can maybe put it on their wrist or on a place on the bottom of the feet where it'll go throughout the lymphatic system. These are some suggestions. We're making a lot of progress with essential oils in cancer care. I hope you subscribe and like and share. And we'll see you next week with more information on cancer care with essential oils. Bye-bye.